Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive care from a qualified chiropractic doctor for appropriate diagnosis and treatment. That's also why BC's chiropractic doctors fund research and education. Today, I want to introduce you to Dr. Stephen Passmore, who's conducting research on measurement, movement, and chiropractic care.
I do some work trying to look at specific populations that can possibly benefit from chiropractic care. Now, before we can jump into a large randomized control trial or a large clinical intervention study, we need to establish some outcome measures for that specific population. And so right now, we're working on lumbar spinal stenosis, specifically degenerative lumbar spinal stenosis, and developing some quantitative outcome measures to try to evaluate that population.
This type of information is multifaceted, but more importantly, it will help a spine surgeon, neurologist, chiropractic doctor, and many other health professionals.
That's one of the real reasons why it's a particularly interesting pathology to study, because spine surgeons in general have a very long wait list before someone is able to get in to see them. And there is a point in time where someone with degenerative lumbar spinal stenosis does become a surgical emergency, and that's when you start to see bowel or bladder dysfunction as a result of the actual progression of the disease. But there's a big window of time that happens before that where people might just be sitting on a waiting list, but they could potentially benefit from conservative intervention like chiropractic.
By establishing where patients can benefit with chiropractic care, we continue to create positive health changes. For a patient awaiting surgery, it can reduce pain and, more importantly, help them maintain their lifestyle. It could also help reduce the burden on surgeons' waiting lists. It's all a part of a chiropractor's role in your healthcare.
Our goal is to try to bring more science to the understanding of the practice of chiropractic in terms of the clinical populations that we can see who may benefit from care, and in terms of the referral patterns, and in terms of just trying to explain what we deliver as chiropractors. If we can use more empirical scientific evidence to describe that, then we have a very strong leg to stand on as a profession.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow and better healthcare outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.